This is Rogers TV. The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers nor Rogers TV.
This is your COVID-19 local update. I'm Deborah Hutchison in the Rogers TV studio. You know, if there is anything positive about life under COVID-19, it's how our communities have rallied together to help those in need and the compassion that is being shown for others. Later on in the show, we'll be speaking with Derek Giberson of Backdoor Mission. But first, I am joined by Ben Earl. He is Executive Director of Feed the Need in Durham, and Ken Hartwick, President and CEO of Ontario Power Generation. Gentlemen, thanks so much for joining us.
Thank you.
Now, Feed the Need in Durham Region, I have to ask you, Ben, you are a food hub that supplies food to many of our food banks. What kind of additional pressure is Feed the Need in Durham under to meet the needs these days?
Well, outside of increased demand that we've noticed in the last month especially for people who need food banks, there's also been an increase in food donations and food available, which is fantastic, but it puts pressure on our infrastructure to make sure that we can collect and get it to people who need it. And then increased, we're also the steward of a lot of the resources that are available to the community to help respond. Whether those are federal, provincial, or donations from other places. So just pressure to make sure that we're stewarding those and getting them to where they need to be to respond to the increased demand that we're seeing.
And of course, with increased demand, you know, food is not cheap, even for you. Ontario Power Generation and Feed the Need in Durham Region recently announcing a rather unique partnership. Mm-hmm. Let's get you gentlemen to talk about that.
Yes. Well, on our end, I'm extremely appreciative of the ongoing partnership we've had with OPG for many years, and in our feeling, this recent announcement of a significant donation to help us is just an iteration of how committed they've been to our work and to our community for a long time. Yeah.
So Ken, tell us how the decision was made. You donated a rather sizable sum. Is $150,000?
It was actually a very easy decision to make because, you know, firstly, we're such a big employer in the Durham region, in the community, and our employee group feels very strongly that, you know, in the community that we operate in and you know, most of our people live, that we're in a position to be able to help. And as Ben described, the needs are great on a whole bunch of different fronts. And I like to think sort of while it is a monetary contribution, which I think is great, I also find a lot of our employees are doing their own individual things to do it. And when you look at an organization that Ben runs, it's you know, it's exciting to be able to help out a little when, as he said, the needs are great.
Mm-hmm. So Ben, tell me how that $150,000 helps. You have, because you buy in bulk, you have buying power, correct?
Yeah, we do. So we can buy food at ratios that are cheaper than if you get in stores, which is great because it means every dollar goes further. In general, it's anywhere from $1 to every 5 to 7, depending on the product we're buying. So we can multiply donations in terms of food purchasing greatly, but it's also about distribution. This grant is not just about buying and bringing in food, it's also about getting it to people and getting it to our member agencies, because that's equally important in the work that we do. It's no good if the food is purchased and sits in a warehouse. It needs to move, and it needs to move quickly to meet demand. And the support from OPG has provided a combination of the two, allowing us to purchase large volumes of food while also making sure we can get it to people.
Let's talk about the challenges, though, of getting it to the food banks and your other members.
So it's mostly a logistics question at this point, is making sure that we can get it into our warehouse and delivered and then onto trucks and out to our members. They each take different amounts, and that's our role, is to help bring in large volumes and get the amounts that are needed by the individual member agencies and then out to the people in the community who need it. Obviously, with the health considerations right now, there's a lot of additional challenges in terms of distancing, lower numbers of volunteers, because we have to restrict who can be in at any given time to provide the safe distancing. But also, our member agencies are all running in very safe ways as well. So it's slowing down things a little bit. In terms of make longer lineups to get people in and out of food banks, and getting food in and out is a little bit more of a challenge, but it's happening, and it's happening safely, and it's happening well. So any support we can get to help manage those additional challenges is greatly appreciated.
Do you have enough volunteers at this time?
We do, and we're constantly getting more requests for volunteers. The challenge for us is that people want to help, but given the health restrictions, we have to make sure we do it safely and responsibly. So we have processes we put in place to help manage people who want to help us in different ways right now, and make sure that we can still run our operation.
Ken, I want to throw it over to you. You know, OPG has done so much for the community during COVID-19. It's not just the money that you have given to Feed the Need. You know, you've been donating masks and suits as well, correct?
We have it, and it really picks up on the theme that Ben has been talking about. Is, you know, as an organization, we have a lot of resources available to us because of the business we're in, and on things like the PPE that we were able to free up. You know, we had a lot, and I think as an organization, I can tell you this is right down to all 9,000 employees. Everyone felt the right thing to do was to put the PPE out into the hands of our frontline workers, the medical community, and then we'll innovate and figure out how we develop more so our employees are safe in what they do. And it really is when we look to do stuff like this, it is really driven by having good partners. And that's when Ben talks about their skill set as far as being able to take, whether it's money or food donations, and then distribute them across, you know, multiple different parties that need them. That's what sort of made it really easy for us to look and say, Feed the Need Durham just was the right thing to do, because they could already then get it to where it was most needed. And it just made the decision easy for us, and it is very rewarding. I can tell you, if you talk to any of our employees, whether they're in Durham or Cornwall, which I was at yesterday, or Thunder Bay, they really like when we help because we can and we should.
Yeah.
So not only the donation to Feed the Need, you know, and the donation of masks and suits, you're also working on a 3D design for the masks, correct?
We have, you know, one of the neat things about working at OPG is that we have what we call X Labs. So it's really a team that's looking at all forms of innovation technology. Now, typically it's to apply to one of our big hydroelectric facilities or a nuclear plant. When we got into the pandemic, the group came forward and said, why aren't they now starting to look at things that might help the medical community or other areas of society that might need to be helped? So you know, I think we shipped out our first set of face shields today. Actually went out to the Ministry of Health. We're doing masks as well. And so we have a group there that, again, it's being socially responsible, that why not help those people that need the help the most, or medical community in that case. And makes you, like I say, it's one of the things that's very proud to work at OPG because of the way people have rallied to various segments of the community that are important to all of us.
You know, Ben talked about how they're dealing with the social distancing and the physical distancing for safety there at the workplace. Let's talk about OPG, because, you know, let's face it, there are a lot of jobs there that you just can't do from home. How are you ensuring the safety of your employees there?
Yes, I think we did two things to sort of address this. You know, the first was obviously, you know, if you're in a more office environment, we now have virtually everybody working from home. We also have some employees that they do physical work, you know, fixing a machine, fixing something, and they have to be there. And they have to be around each other, and sometimes very difficult to be 6 feet apart if you have a group of 4 or 5 fixing a piece of equipment. But again, culturally, as an organization, what we've always been very good at is safety protection of our employees. So it's just been adapting that same culture, whether it's working from heights, working around electrical equipment, working around machines. And now say we have something a little bit different, you know, that we have a virus. And so we've taken the steps with our employees to ensure that those that have to work, closely together, have the proper PPE, have the proper sanitization activities to allow them to work safely. And again, it's something our employees have been great both in coming up with suggestions, but also recognizing that we know we need to keep our plants running because the power system is one of the enablers for everything that Ben does and for the medical community and others that are dealing with people who need help.
Okay. Ben, I'm going to throw this back to you. You mentioned, people are still coming forward and they want to volunteer and they want to help, and you can't have as many volunteers there at this time, but there are other ways they can help, whether it be money, and there's certain ways that they can help. You have 3 different programs. Let's talk about that quickly. The first, your distribution program. Donate to the distribution program.
Yeah, so the distribution program really revolves around our transportation logistics. We're in the process of adding a truck to our fleet, a refrigerated truck, which is exciting. We haven't added to our fleet in a few years, which is great because this is not just about, for us, this is not just about responding to immediate need. It is also about, we're going to go through a lengthy recovery period that the need is going to still be there for many people. And we want to be ready to not only deal with the current crisis, but also the recovery period. So building out our infrastructure around our ability to distribute and collect food is important. So that mostly involves transportation, but also some warehousing supports. The next piece is our food purchasing. The resources, the contribution from OPG is a big part of that. But purchasing food is key. And we're doing it strategically right now because the supply chain is there, but it's slower. So we're having to make purchases in advance so that we can make sure we have food in the warehouse over the next few months as well. And then there's just donating to food and to general support for the organization to be able to run and operate, and donating food as well. That's a large portion of what our community can do. If they can't make a financial contribution, they can find ways to do small food drives, whether it's at home. We have people doing porch pickups with their neighbors. We can give advice on how to do it safely. And there's ways for people to support what we do in any way. And if you can't support Feed the Need, there's always ways to support one of our member agencies who are doing the amazing frontline work of getting food to in the hands of people.
It's hard enough figuring out my grocery list to last 2 weeks. I can't imagine the challenge of ordering ahead for Feed the Need on that volume.
Yeah, we manage it by focusing on key items. We know that we can't supply everything, but what we try and do is focus in on what can make up the foundation of a healthy diet for a family, or individual or family. And that's how we manage it. And we've got great partners, places like Feed Ontario, who are working with us in Durham, we're going to be putting out about 9,000 hampers. This is a provincial program, so it's happening across the province, but in Durham, we're going to be putting out about 9,000 hampers that provide a week's worth of groceries each to people. Those are very selected around building a foundation of a diet because we know we can't be everything to everyone, so we focus our attention on what are key items for a healthy diet, and that's how we approach our food purchasing.
Okay. Ben Earl from Feed the Need in Durham and Ken Hartwick from OPG, thank you both for joining us today. Stay with us. We are going to take a quick break. When we return, our focus turns to the backdoor mission in Oshawa.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
I did it.
I need it.
The hero gave it.
And I am alive.
As an organ donor, you can save up to 8 lives and enhance the lives of 75 others. Please go to our website. Pledge a gift of life. You'll be glad you did.
And welcome back to your COVID-19 local update. You know, we're all told to stay in place, to stay home, to stay safe. That's easier said than done when you don't have a home to go home to. Joining us now is Derek Giberson. He is board president of the Backdoor Mission in Oshawa. He is also an Oshawa City Councillor. Derek, welcome.
Thank you.
And thanks for joining us. For those that don't know about Backdoor Mission, what is it?
Backdoor Mission is a very, I like to call it very low-tech frontline social agency working in our downtown. And by low-tech, I mean that it's very low barrier. Individuals don't have to sign up to any programs to be a part of it. It's for people who are, amongst the vulnerable socioeconomic population who, in normal times, we would have 4-day-a-week drop-ins where there's meals and things like clothing service. There's pantry service and just generally a social hub for these individuals. So it's been around for about 25 years when it was started by Simcoe Street United Church congregation members a quarter century ago, and in the last, 6 years has since become its own, still in the same building, but its own independent nonprofit corporation that works in the downtown serving those residents.
So, now that we are living amongst COVID-19, how has that increased demand for what Backdoor Mission is providing?
We've seen a lot of social agencies that have had to really adjust or draw back, or in some cases suspend their services in the last month and a half, due to the need for reducing transmission risks, social distancing. And we made a decision around that time that we were going to try our best to find whatever ways we could to balance the need between playing our part in reducing transmission risk, but also serving that vulnerable at-risk population. So a lot of things have happened in a fairly short amount of time. About a month ago, we were starting to see how COVID was destabilizing an already very at-risk population, and we were hearing this from from other service agencies. We were hearing it from grassroots groups, individuals. We were hearing it from the BIA, and so I got on the phone with Mayor Carter, and this was on a Thursday, and we talked briefly about it. We agreed we needed to set up a video conference the next day. The next afternoon, we pulled it together very quickly. It's about 24 or 25 individuals on that. And they represented a lot of those frontline groups and individuals and service providers. And some of the common themes that came out of that conversation was things like lack of access to washrooms, showers, greater food instability, just a general increased malaise amongst the vulnerable population, anxiety, stress, uncertainty, aggression. And it was very clear that there was some very major gaps that needed to be filled up during this time. So for the Backdoor Mission, the first piece of that meant expanding our services, where we opened up our lunch service to 7 days a week. We just scaled up to that about 2.5 weeks ago, and getting washroom access from just what used to be usual drop-in hours, a couple hours a day during weekdays, to 7 days a week, 9 a.m. to 7 p.m. And we're just about putting the finishing touches on some shower facilities as well. So that was what it meant for the Backdoor Mission. But for the building that we are in, it has also meant a whole other project that we have been undertaking, and that's just started to open up and provide services with a bunch of other service providers in the area.
And that has led to what you were calling Mission United. Talk to me about all the groups that have really come together in a very short period of time. I guess you're creating a centralized crisis hub, yes?
Yeah, that's probably the best way to describe it. We have multiple agencies who are now moved into or moving into one facility. We have nurses and a doctor from CMHA who were some of the first ones on site providing healthcare services. Just yesterday, Durham Mental Health Services have started setting up a mental health space on site with a rest area and mental health supports and crisis supports. The social worker from the PCOP team, which is the primary care outreach program that the Durham Region started about 2 years, just under 2 years ago, I believe. She has set up a field office here as well, which works really well because she's able to connect directly with many of the clients she would usually be having face-to-face encounters with, who are sleeping rough, living in encampments, things like that. And then we've had considerable support as well from John Howard Society with harm reduction supplies. There have been some members of Lakeridge Health who have been very supportive and looking at Caria Community Health as well. They regularly set up their mobile community health van right outside during our lunch hours. So yeah, it's an ever-changing thing, and hard to believe that it's something that has happened in basically the last month, because projects like this usually are a 6 to 12 months project to scale up. So it's been quite a considerable undertaking.
A considerable undertaking, but along with the challenge has come great success and proof that when people get together, they can get things done. They can work together. How has the number of people that back Durham Mission, I guess now Mission United, how many people? The increase, I guess, is what I'm saying. How many more people are accessing your service?
So, I mean, in terms of the ones who are getting the medical and mental health services, that's completely new under this roof. The meal services are usually between 120 and 140 people getting meals a day. So that tracks a little bit higher than what we were doing before when we had 4-day-a-week service. But it's a considerable increase in terms of total number of meals per week being served compared to what we were doing before.
And how do you, I guess, make ends meet? How do you provide that increase in meals and pay for it?
Yeah, so that's a great question. So on the operational side, we have been really fortunate to be supported by the Region of Durham's Health and Social Services Department. They saw that very early on that this need was a considerable one, and I tip my hat to both Mayor Carter as well as Councillor Chapman, who is the chair of Health and Social Services at the region, because they did a lot behind the scenes to really support. They already understood the need here prior to the pandemic. And so they were able to really do a lot to support to get this up and running. The region staff have been absolutely fantastic in applying for an emergency grant through the federal government, the Reaching Home grant, to help support the work that we're doing here. But on the food service side of things, in particular, we've had some really fantastic community partners who have stepped up. Feed the Need, was already very supportive of us before, but they've really pulled in to make sure that we're backed up on the front line. Gordon Food Service out of Ajax, they've several times now have showed up here with food delivery trucks with several skids of fresh produce and fresh food, which is really hard to obtain for a lot of these individuals right now. And supports like that have been fantastic. Vaughn, the truck driver from St. Vincent's, has been really terrific, showing up with his truck from Costco and grocery stores in the area with food that is still good, but had to get out the door. So it's been really, a really well supported endeavor. We definitely have not been doing it on our own here.
How can people help? Do you accept donations?
Yeah, we sure do, and we gladly accept them right now. Our operational costs, we have had to bring on new staff just with the amount of hours we have to be open. There's a cost to that, of course, other operational costs, but yeah, it's pretty easy to find. If you go to the backdoormission.ca website, you can find somewhere on there, I think it's near the bottom of the page, or there might be a support link at the top, and that's a direct link for people, if people are looking to help us with financial donations. We gratefully accept that, because that's a big help for us right now.
I have to ask you also about, I guess, how do you protect those that use your services and yourselves from the possibility of COVID-19 transmission?
Yeah, so that's very important. And, we right from the get-go, when even prior to getting the Mission United project up and running, we basically started some very rigorous cleaning processes and sanitization processes after every washroom use, after, anytime a table is used. Now, most of the clients are getting the food service through a takeout service right now. So that is obviously one of the big ways. It's not like normal business as usual at the Mission, where there might be 50 or 70 or 90 people all in the hall at the same time. We can't do that, and we wouldn't do that even if we were allowed to, for their safety and for the volunteers and staff safety. But we also have a professional cleaning service on site who have certification in basically the non-scientific way of explaining it is medical facility level cleaning and sanitization. So there's that. We have a screening checkpoint for any clients who need to come in to access services. They're first screened with the questions of to see if they're symptomatic before they're allowed into the building. And and then the other, the usual personal protective equipment, we have that on site as well too. We've had some great donations as well from some of our neighborhood friends. All or Nothing Brewery has, Councillor Rick Kerr has managed to procure some of the hand sanitizer that they've been producing. I have my mask here from Frere du Nord, who have converted their clothing production over to face masks, and they've donated several hundred to us and other agencies in the area. So, and we're taking all the best advice that the medical professionals here have for us as well too.
We only have about a minute left, but Derek, I have to ask you, how are you handling all of this? You are a counselor, you are so involved in this. Doesn't leave much time, I would think, for you.
Not for the time being. I've been doing 12-hour days for most of the last 5 weeks. It's starting to let up now that we have some of our new staff on board, though, and they're doing really great. I guess the only saving grace in a way is that my phone and email have been fairly quiet during this time. I think that a lot of the services that people are looking for in the near term are at the provincial and federal level, with the income supports and things like that. So that's been
I'm going to have to stop you there, Derek. We're almost out of time. But sure. Let's make a date so that you can join us again. Our thanks to Derek Giberson, Ben Earl, and Ken Hartwick, and thanks to you for joining us. Until next time, I'm Deborah Hutchison.